You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have board-certified oral and maxillofacial surgeon, Dr. Sanil Nigalye. Dr. Nigalye, welcome to the program.
Pleasure to be here today.
All right. Now, lots of questions for you, and I know you brought some photos. We'll talk a little bit about those. But for people that don't know your practice, who's the typical dental implant patient that you see?
Yeah, well, there's not really a specific typical implant patient, but they generally fall into two general categories. One is a person with teeth, and one is a person without teeth. So the person with teeth is usually somebody who's very frustrated with their current situation. They have loose teeth, bleeding gums, bad breath. They've got these kinds of problems. Also, they will have broken teeth, and they're really frustrated about having to go to the dentist constantly to make these repairs, or sometimes they're just frustrated with their situation because they're embarrassed by their teeth. In most of the cases, their teeth they know that they're headed for a denture.
Okay, and they don't want a denture.
They don't want a denture. It's kind of, to be quite honest with you, it's kind of antiquated technology. A standard denture, and nobody really wants to be taking a denture out and putting it on their nightstand at the end of the night, especially if they're younger. But now we're even seeing older people that don't want that either.
Okay.
And for those people, we give them upper and lower teeth that are supported by implants.
Okay.
The second group are the people without teeth. They're wearing dentures. They're frustrated with their dentures. They're not aware that there's other options out there for them.
Are there a lot where you are?
There are
like
a
in
lot.
The state of New York, would
Yeah.
you say hundreds of thousands of people?
I would say in the state of New York, probably millions of people, to be quite honest with you.
Have an upper lower denture.
Yeah. At least one edentulous jaw, meaning no teeth in that particular jaw. So it's about, I actually ChatGPT'd it this morning. It's about 36 million Americans are missing teeth on one or both jaws. So for what we can do for these denture wearers, so they come in with no teeth, we can put in implants, and they can leave that same day with teeth in their mouth.
With upper and lower teeth that don't come out.
With upper and lower teeth that don't come out.
Now, if it's so good, like, what's your take? If there's 36 million, maybe a million in New York that have an upper lower, why aren't they all doing this? Why aren't they all getting new teeth with implants? What's your take?
Well, there's a few reasons. Number one, the most common reason is they're really out of the system. They're only seeing their dentist at this point for a sore spot adjustment, or if they've got a loose denture to do a reline. So they're really not in the system.
They don't know their options?
They don't know their options. No one's talking to them about their options. So that's the main reason. The second reason really is that they're afraid. They're afraid to get back into the system because you see, a lot of these people have had a long history of dental care. These aren't people that have ignored their teeth. They've had a long history of dental care, and once they had their teeth extracted, it was like liberating for them.
Is that right?
They no longer had to worry about the pain of going to the dentist, having to get a Novocaine shot, all of these different things. And the expense, correct. So they're not always so willing to get back into the system. However, they continue to live with this frustration. And
so the denture wearers, you could probably even help the most. It's just tough to get them in the door.
It's tough to get them in the door.
They don't know their options.
They don't know their options. And, you know, part of me doing this broadcast today, Randy, is that so that we can get the word out, so that they can see us on TV and they can realize that there are other options that they can take advantage of.
But isn't it true though? I mean, if you've been wearing a denture like 10 or 15 years, you can't do this because you don't have enough bone. Is that right?
That's not true anymore. We've got specialized implants. We've got newer technology that allows us to help these patients that even have limited bone.
Do you hear that from patients from time to time where they say, I was told I don't have enough bone to do this?
100%. We get patients from all across Western New York that come to us and have been told that they don't have enough bone, and we're able to utilize some of the technology and specialized implants to get them implants and get them a fixed set of teeth.
So you are like one of the go-to oral surgeons, or the go-to oral surgeon in Williamsville, New York. I guess lots of other dentists send you their implant patients.
That's
Is that correct?
That's right. We work with general dentists, we work with prosthodontists, we work with periodontists, we work with all different disciplines, and really try to create like a multidisciplinary approach to implant care. So,
okay.
Yeah.
Now, even though you get a lot of referrals, and we've talked on the phone about this, correct me if I'm wrong, how dental implants are typically done is 2 or 3 places. You go to one place where they do the surgery, another place where they put the teeth on top. At your office, you have the ability to do both parts. Is that correct?
Correct. We have the ability to do both parts. We are able to actually do the surgical aspect of it, and then we're actually able to do the restorative aspect of it as well when the patient doesn't have their own general dentist.
If they don't have their own dentist. So they don't have to leave their dentist. You'll work together as a team.
100%. We do that all the time. In fact, we encourage working with their general dentist so that they keep their dentist because most of the time patients actually like their dentist.
Okay. Now you have a machine, I'm calling it a machine, that prints teeth.
Correct.
On site.
That's right.
Is that right?
Yeah, it's a 3D printer.
Okay.
And we're able to acquire the records, acquire the implant positioning. We work with a lab. That lab is a remote lab that will then send us the data in order that we need in order to print the teeth.
Okay. How old can you be to get this done? Like, what's your oldest patient?
Our oldest patient is in the 90s.
Now, why would a 90-year-old want to do this?
Randy, think about being a 90-year-old. What does your life really revolve around? It's you're eating, you're laughing, you want to spend time with your loved ones.
People are bringing you food, probably.
People are bringing you food all the time. So there's a great motivation for a 90-year-old to do this because this is a great sense of joy for them.
What do you do for that 90-year-old?
Yeah, so we were able to place dental implants to help her hold in her denture.
Okay.
Yeah.
And so she gets a full arch of teeth that it's kind of locked in.
It's locked in. It snaps in. It's
Is that
snap.
right?
Yeah.
Okay. And you offer both teeth that don't come out, or teeth that are kind of locked in, snap out.
Correct. So her particular situation, she was wearing dentures, but she wanted something that was more secure. So we were able to do that for her. But yes, we do.
Now, statistically, are they more likely to fall out if you're 80 or 90 years old? These implants?
No,
Is it a misconception?
That's a misconception.
So when a 75-year-old is in your office and says, "Doc, am I too old?" Not even close?
No. In fact, when we get 75-year-olds and we get sometimes 60-year-olds or 65-year-olds, and they say, I think I'm too old for this. And so then we do a consult for them, and then they disappear, and then they come back 5 years later or 10 years later, and they are interested in going through this all over again. So we do another consult, and then we do the procedure, and they really think to themselves, their biggest regret is, why didn't I do this the first time I came in here 5 or 10 years ago? So it's unfortunately, that was their choice, but
So they lost out a lot of good years.
They lost out a lot of good years.
What do they like the most? The way it looks? Because I've seen some of your photos on Instagram. Yeah. Do they like the way it looks, or do they like what they could eat? Or is it a combination of both?
Yeah. What happens is it works both ways. Sometimes they like the way it looks. They're doing this because they want to look better. They want to feel more confident. But then once they get the teeth, they're like, wow, I can eat all these foods. And so that comes in the forefront. In the other case, sometimes they just want to eat. And so
that's their motivation.
That's their motivation. They want to be able to eat. They want to be able to eat the foods that they love. But then they're smiling all over town. They're
so they end up liking
confident.
The smile.
They're getting they're dating again. So it kind of works both ways, and people are surprised in how it helps them.
Can they bite into anything like a raw carrot with their front teeth, or you have to be careful once they're all healed up? I mean, they could bite into whatever.
Once they're all healed up, they can bite into whatever. Yeah,
whatever you could eat with your regular teeth, you could eat.
For the most part, you should be able to eat
like almonds or nuts and things like that.
Yeah. You wouldn't want to chew on like ice or anything like that because that would hurt even your regular teeth. But yeah, you can eat most any food. When you have bad teeth, it's hard to even eat simple things like salads or pizza.
Is that right?
Yeah. And so when patients get these new teeth, they're surprised at how well they function for them.
Now, what about this? People on medications, because now you're a medical doctor and an oral surgeon, but statistically, I guess people are on, if you're over 70, 4 medications. Can you be on osteoporosis medications? Can you be on blood thinners or diabetes medications and still do this?
Yeah, I mean, that's our typical patient.
Is that right?
Typical
Okay.
patient is on multiple medications for multiple problems. So there are certain medications that might put a patient at a slightly higher risk, but again, we're going to work with your primary care physician to figure out all the risks and get to the best possible outcome.
But what about bad gums? I mean, gum disease, periodontal disease. Can they do this? I mean, that's why they're losing their teeth, the bad gums.
That's like the perfect candidate for this, actually. Patients that have loose teeth with gum disease. Once we remove their teeth, we're able to, and these are patients that are not candidates for conventional periodontal therapy. So when the periodontal disease gets so bad that all we can do is remove their teeth,
Okay.
then yeah, I mean, they're the perfect
Do you
candidates
clean up
for
this bacterial infection? Is that what it is, a bacterial infection?
That's right. That's
Do
right.
they feel, so by definition, are they healthier when you remove that infection?
Absolutely, because their immune system's been fighting this, all of these years, and so that's been a drain of resources to their body.
Well, now, what about the bad breath associated with gum disease? How soon does that go away?
Once the teeth are extracted,
Yeah.
immediately.
Is that right?
That's right. Yeah.
That's
Once you get rid of the teeth, the bad breath is gone.
okay.
Yeah.
So if the people are of the two categories you talked about, so they have really bad teeth and gums, and maybe they were told elsewhere their only option was a denture, but they don't want a denture, or the denture wear. They're watching this. When they go to your office, like, what are the steps to getting this done, to get to those teeth that don't come out?
Yeah. So it's for the most part, it's a 3-step process.
Okay.
Step 1, we give them a few options. We go over all of their options that are available to them. Step 2, we do a smile design. So we get whatever records that we need for that, and we sort of come up with what they're going to look like once they have their new teeth.
Is this done on a computer?
It absolutely is, yeah. So we take.
Is that why it looks so real? I mean, most of it is
right.
now all computer?
It's all computer, so it's all done digitally.
Okay.
Yeah, and step 3 is really the step where they get their teeth.
You get your new teeth.
That's right.
What's it like when they look at the mirror for the first time?
Tears, usually tears of joy. They can't believe it. They just look at it and they're astonished. Yeah.
And they just wish they. Yeah, I had a guy one time tell me the most expensive part about dental implants is going out to eat all the time.
Right.
Do you find that a little bit?
Very, very true. Yes. We've had people disappear after their surgery, and we can't find them. And we've tried to we've called them. We've tried to locate them. We had one gentleman. We wound up calling his daughter, and his daughter said, since my dad got his teeth, nobody knows where he is. He's the most social person that. He's always out having a good time. So the interesting thing is when he came and saw us initially, we thought he was a very grumpy guy and couldn't imagine it. And now he's like the life of the party.
Is that right? As far as maintenance, they just get them, like, go to the dentist once a year, a couple times a year, get them cleaned?
Yeah, we see our patients back annually to check. Do the same thing you would do with regular teeth. We take X-rays, make sure that the teeth are healthy, make sure the implants are healthy, and make sure that patients are doing a good job maintaining them.
So are they supposed to last? I mean, once it's done, like if somebody in their 40s or 50s gets this done, they can last as long,
Yeah.
their entire life.
Yeah, that's a really good question. As long as they take care of them and they themselves stay healthy, they should last a lifetime.
Is that right? Now I'm going to put you on the spot here because you're an oral surgeon and a medical doctor. Does it cost more money to go to a guy like you with your training?
It really shouldn't cost any more to go to someone like me. We've streamlined the process so it's become more efficient. We use digital technology. We've been able to really bring our own costs down as a result of that. So it really shouldn't cost any more to go to me than anyone else.
So for the two categories of patients that seem to be getting these dental implants, the people that still have teeth but they have to be removed, it's been determined you can't save the teeth. Or the other patient which is currently wearing a denture. What are their implant options, number of implants, that it takes to get them their teeth?
Sure. So one option is to do like a snap-in, snap-out type of denture. In the lower jaw, we would use either 2 or 4 implants, and they would really just act as posts for the denture to snap into and come out. So it's still a denture, functions like a denture. You still take it out.
Are you a fan of that?
Not a big fan.
Why?
It works in the lower. It definitely does not work in the upper jaw, and that just has to do with the density of the upper jaw, and so we don't even really do it in the upper jaw anymore.
So the patient satisfaction is very low on these snap-ins.
Patient
But it's
satisfaction.
better than a loose-fitting denture.
It's better than a loose-fitting denture, for sure. So if that's where you had to be, it's better than a loose-fitting denture.
Now, there's a lot of doctors, and I've had them on the program, that like the snap-in uppers as well. You said you won't even do them anymore.
No, we don't do them anymore. They've proven to not work in our office because that constant pulling and pushing and pulling and pushing on that soft bone, they don't hold.
Doesn't work. Okay, so what's the next level up?
So the next level up is really where we'd like everybody to be, and that's in a fixed, where the teeth are fixed into place.
Okay.
Okay. So that's where they don't come in and out. You've got 4 or more implants, and the teeth are screwed into those implants. So they can come out, but only a qualified dental professional would take them out.
So like 4 implants, 4 to 6 implants on the lower for a full arch of teeth.
That's right.
That don't come out.
That's right.
And on the upper?
4 or 6 implants on the top.
Same thing.
Same thing.
Now, what about the roof of the mouth? Is it going to be covered still?
No, it's open. So you'll be able to taste. You'll have there won't be any gagging. Sometimes patients get very gaggy with the roof of the mouth being covered like that. So yeah. And the other thing is that with dentures you're continually losing bone, but with fixed teeth you're not losing bone because it's not compressing the bone the way regular dentures are.
So the pressure on the bone keeps you from losing more bone. Is that why their face sinks in? Like with denture wearers? Their face starts to sink in?
Their face starts sinking in because their bone is shrinking, because the compression of the dentures causes the bone to sort of dissolve away.
Do you think that's the future of dentistry, taking a peek into the future, that dentures as we know them today, maybe whether it's 20 years or 100 years, they'll all be attached to something like implants? That traditional dentures will be gone?
Yeah, I do. In fact, it's sometimes surprising to me that anybody's still making them at all, even today. Forget 20 or 30 years from now. Even today, it surprises me that anybody's opting for conventional, what we think of as conventional dentures. It's really almost like if you lost a leg, would they attach a peg to the remaining stump? Like nobody would do that.
Old school thinking.
Yeah, correct.
Is that right?
Right. If you went to a car dealership, would they sell you a horse and buggy? No. They may sell you a different kind of vehicle, but it's still going to be a car.
So dentures are just outdated.
They're outdated.
In your view.
They're outdated technology.
So that will be the gold standard in the future.
I would believe so. Yeah.
So let's talk about this robot. You call it the Yomi. It's called the Yomi robot.
Mm-hmm.
And it helps you do surgeries more precise, better, what?
Sure. All of those. So it's really for precision. So fundamentally, surgery should be precise. You don't want to go to a surgeon that's not as precise as he can be.
Okay.
And so one of the central themes that I like to use is that, good enough is not good enough for us. We're trying to get as precise as we possibly can. And so
and does precision mean, because you're dealing with the gums, like less downtime or less soreness for the patients if done properly or precisely? Or is it more of something else?
It's more about making sure that the implant is in the right position for stability, for making sure there's enough bone around it, and also for the final restoration. So when the teeth actually go onto the implant, we want to make sure that they're in the best possible position.
So that way it'll last.
It'll last.
So it won't break.
Correct.
Is that right?
That's right.
So what do you tell your friends about this Yomi robot? Because I know they're not inexpensive.
Right.
But it's worth it to you.
That's right. I say if you want to be, it depends on how important precision is to them. So if it's important to you, then this is a great tool to add to as a clinician.
To get it.
Mm-hmm.
Now the other technology, photogrammetry. What is that?
Photogrammetry is great. It is technology that's been adopted by the aerospace and automotive industry, and we use it now in dentistry to capture precise implant position. So when we're doing these full arch cases, we can get the precise implant position, and then we can get the teeth that fit exactly onto the implants the way they're supposed to.
And this will just make everything last longer.
Correct.
Is that right?
That's right. Because it's all about
So
precision.
if they took your photogrammetry away, your robot away, would it just make it more difficult for you?
Yeah, I couldn't go back. I couldn't
Really?
go back to doing it without it, because I can see, I get to see things that I don't normally see, and knowing what I know now, I could not go back.
Couldn't go back. It's really the way. Do you think that's the way implant dentistry will all be practiced in the future, using these type of technologies?
Oh, I think the technology is only going to improve from here.
Is that right?
Yeah.
Now, you're an oral surgeon, okay? You're doing these extreme smile makeovers all the time. You probably think that like the smile or healthy teeth and gums are the most important thing. How important is it?
Smile is very important. I mean, a smile is basically how we interact with the world. It's part of our charisma. It's
Okay.
how we, it's how we make friends. It's how we create relationships, and it's how we, if you were think about it this way, Randy, if you were applying for a job, or if you were interviewing for a job and you had two candidates, you're gonna hire the person who's smiling or the person who's not smiling.
That's true.
It's really,
I guess the one that looks positive or acts positive,
Correct.
looks healthy.
correct. It's
a good point.
It's a positivity. So the way we smile or how often we smile affects our mood. We all feel better when we're smiling, and how our mood basically is a big part of how we perceive the world and how the world perceives us. So it's a very fundamental emotion, or a very fundamental display of emotion, of happiness.
Now, some people, we've talked about this, that some people, they get their new teeth and they start dating again, or they get out of a bad relationship.
Yeah.
Is that right?
We've had a lot of people come to us because they want to go back into the dating scene, or they want to find a relationship. And so we've had people that have come to us, and not only have they found those relationships, but they've also lost 20 or 30 pounds. They've quit smoking. They've made the decision to change their entire life.
So is this like the third set of teeth? You get your baby teeth, adult teeth, and then now you have these new teeth?
Yeah, well,
They're artificial, but they are teeth.
That's a bit of an exaggeration, but yeah, I mean, some people do think of it that way, for sure.
Now, I've heard people say it's the first day of the rest of their life and things like that. But for some people, it's a big deal, right?
For most people, it's a big deal. For most people, it's a big deal. It really does. It really absolutely does. I mean, I share this with my team to get my team on board, but I talk to patients afterwards. I call them, and they will tell me over the phone. They will tell me that how happy they are now that they can actually taste their food, because when you get these patients that are in dentures and they've been told that they don't have enough bone, they're wearing these dentures and they really can't taste their food because you have taste buds on the top of your mouth, on the roof of your
because
mouth.
the palate's covered.
The palate's covered.
Okay.
So they can now taste their food. They don't have to take their teeth out at the end of the night and put them in a jar. They just feel normal again. It really normalizes their life.
You said people will tell you that with their bad teeth, they feel judged. Like, for example, like in the movies. It's like every director, if you want to make somebody look homeless or poor, you give them bad teeth.
You give them bad teeth.
Halloween stores, they sell the bad teeth.
The villain usually has bad teeth,
Okay.
right? The bad guy usually has bad teeth, right? So people feel badly about the fact that they have bad teeth. And so once you give them a nice, bright, white smile, it changes how they feel about themselves.
Is that right? And how people perceive them.
And how people perceive them.
Like their friends
That's
go, what's
exactly
gotten into you? And all they're doing differently is smiling?
Yeah.
Possibly?
That's right. I mean, I think that you would know instantly if you were in the room with people or a person that just wasn't smiling. It sets the tone. There's an energy that accompanies that, either if they're smiling or they're not smiling.
Now, there's a lot of good to this, but it seems very painful.
Yeah, well, during the procedure, they're numbed up.
Okay.
So they're not really feeling any pain, we do provide IV sedation, so they're very comfortable, and usually they have no recollection of the procedure afterwards.
Right?
Yeah. And afterwards, they're typically not complaining of pain. That's not a major complaint.
Are there patients that take because you offer medications
Sure.
to control things when it's all done, right?
Sure.
The next day. But are there some people that all they need is over-the-counter, like whatever you're getting, like ibuprofen or?
What they're using mainly is over-the-counter. We do prescribe
Okay.
we do prescribe other medications, but sparingly, because we don't want to create problems out there. So they're mainly using over-the-counter
Like what?
medications like ibuprofen and Tylenol.
Okay. And that does it.
And that does it, correct.
Have you ever had people that say, I was so worried about this,
Yeah, I mean,
and it was easy?
usually after the procedure, they've moved on from that. They're not even talking about pain. They're not even thinking about it.
Is that right?
Because it wasn't painful.
Now, because they can eat so well, they're eating. Do they gain weight? Do they lose weight? Because now they're not eating a bunch of soft, maybe carbohydrate foods. Now they're able to eat like raw vegetables or lean protein. What do you find there?
Yeah, so actually, because our diet is limited when we have loose missing teeth or bleeding gums, the foods that they tend to gravitate towards are high carbohydrate foods that don't have a lot of nutritional content. So what happens is once they get their teeth is they're able to start eating the salads. They're able to eating the meats and things like that. And what happens is they wind up getting in better shape is what happens.
Is that right?
So if their weight was low, they gain some weight. If their weight was high, they usually wind up losing some weight. Yeah, and we see that.
All right, we're out of time. Final message to the people that are watching this. They either are wearing a denture or their teeth are so bad they feel like they're going to end up in a denture. They've heard what you have to say, but for whatever reason they're afraid or they're scared or whatever. Or they don't think they're a candidate. What do you say to them?
Say, come on in for a consultation. We'll talk about what your options are, and we'll come up with something that works for you.
Okay. Now, do you get to see the patients every time?
I always see the patients.
Because there are some centers where the oral surgeon doesn't really meet them. Is that correct?
No, we have a sort of a little bit like a boutique practice. So I meet every patient.
Okay, nice. And if they want to make an appointment, do they go online or do you prefer they call your office?
They can call our office.
All right, I want to thank you for coming on the show. Good stuff.
Thanks for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.